All right. So, welcome everyone. I'm Dr. Jessica Chung. As some of you may know me, some of you may not know me. I am a doctoral prepared nurse practitioner and I am an entrepreneur. So, today we're going to walk through how to build a structured, profitable practice. So, this is not theory. This isn't something that has been just made up. These are actual steps and strategies that I've used myself in starting my own practice, and how I've also helped many across the country start their own practices. So, um, this is definitely something that I've taught many times, and some of you have probably joined this masterclass before. So excited that you are back again, if that is the case. So, what you'll see today is what it really looks like to go from a business idea to an operational standpoint. So, what you'll learn today, by the end of this masterclass, you should have clarity on a few things. First, how to choose the right practice model based on your goals. Secondly, how to think about revenue and pricing your services in a way that actually makes sense. And third, why most healthcare providers stay stuck even when they want to start. And lastly, what it actually takes to move from thinking about your practice to actually building one. So, who this is for? This is for all of you that are here today. So, if you are a provider ready for a profitable practice, or maybe you started your practice and you don't know what the next steps are. You started the process of starting your practice and you don't know what the next steps are. So, this is specifically for all healthcare providers, nurse practitioners, physician assistants, nurses, physicians who are either thinking about starting or already started. So, some of you are at the beginning stages, and that's all right. And some of you are already in the process, but you know something is off. So this is for everyone that's on both spectrums and in between. So the goal for today's training is to give you clarity, give you confidence, and give direction. The goal is to take away the overwhelm of the process of starting a practice. So there's so much information that's out there. There's so much, guidelines, books, and everyone's doing a webinar. Everyone wants to teach you how to do it, but not all that information out there either is practical or if it's even factual. And it may even cause you to be even more confused than you were before. So, this training is to remove confusion, give you a roadmap, and show you the simple steps that you can take. So, as I mentioned, I am a doctoral prepared and board certified nurse practitioner. I own a primary care practice in Tampa, Florida, where I am based. And I also run the International Business Association for Nurses, which we are a healthcare business consulting and educational company. So I've worked with providers across specialties, as I mentioned, helping them start all different types of practices in a way that actually works. My own journey, I definitely started in a different way from the opportunity that you all have. I started my practice as a mobile practice, and I didn't have a mentor. I didn't have anyone that was offering a webinar. I didn't have anyone to kind of guide me and lead me. A lot of the information, if not all the information, was just really trial and error. And so I definitely took a longer route, and it took me much longer to start my practice, but nonetheless I've been able to grow my practice. This October, we'll be celebrating 7 years at JC Healthcare and Associates. I've been able to build and expand multiple service lines. I've been able to expand my practice across multiple states, and I've been able to build scalable systems. And I came to a turning point in my career, and a lot of you are also at that turning point. I came to the realization that what I was doing in my work, in my career, my profession as a nurse practitioner, that I could also duplicate that and do that for myself. So I was working for a practice that it was based on, I received a bonus based on the revenue that I generated as one of the providers. And with that being said, I was able to see those numbers. And I saw that as a nurse practitioner with approximately, I want to say at that time, I had about a year experience, that I was generating over $1 million annually for an organization that was just paying me a fraction of that, right? So I came to that realization at that moment, that was like a light bulb literally went off in my head after I saw those numbers. And I thought, well, if I could do that for practice I was working for, what would be the difference, or what would stop me from doing that in my own practice? So that I share for everyone to understand that the value comes from you. You have the expertise, you have the knowledge, you have the education that drives revenue for these healthcare organizations. No matter if you work for a large organization, a small local organization, whatever the case may be, even if there's hundreds or thousands of employees, you still have value in that company. And that value comes from you directly. And you can build your own practice with the value and the expertise that you have. So many of you join this masterclass because obviously you're looking for information, you're looking for an opportunity, you're looking for guidance. So you're ready for more, and you all deserve more. Just like I realized back at that time working for that practice that I deserved more. You're carrying a load of patients, whether in clinics or in hospitals or wherever you may work. Some of you are probably charting at home, and some of you are feeling undervalued. Some of you are definitely underpaid. I know I was. And you want freedom. You want financial and professional freedom. And I'm here to tell you that that is very much possible. So I'm going to go through some examples of the revenue that you as providers generate, and how the impact you have for the organizations that you work for. So, for example, for those of you who are providers, nurse practitioners, and PAs, on just a average can generate 375 to 650,000 a year in revenue for their employers. And I have just shared with you guys that I know for a fact that I generated over $1 million in revenue years ago for the employer I was working for. And where does that revenue come from? As the provider, it comes from the patient volume that you carry. It comes from coding and billing for services. It comes from the continuity of care. It comes from procedures. It comes from all of those things, is how you are able to generate revenue for your organization that you currently are working for. Now, for those of you who are nurses, you are also generating revenue for your organization. On average, $2 to $4 million in annual hospital revenue per unit through patient flow, quality outcomes, and care efficiency directly from RNs and LPNs. That is seen from increased patient volume and access, reducing wait times and length of stay, billable encounters and procedures, quality metrics, value-based reimbursement, continuity of care, and patient retention. So even though you may not be the provider, the one that's giving orders or prescribing treatments, you still, as RNs and LPNs, are providing a significant amount of revenue support for the organizations that you work for. And I will also go through the practice systems that many RNs and nurses are starting up as well. So you can build this for yourself. And that's something I realized. And it's something that once I transitioned from working for an employer and different organizations and starting up my practice, that became more of a reality. But to be honest, I don't think I would have realized how much of a reality it truly was until I actually started. And so that's why many of you are in that kind of space where you know you want to start, but you know you need the stability of your employment, which is totally normal and definitely recommended. However, if you truly believe that you can see more and do more and receive more, then you do have to take that next step. And so therefore your license, your profession, your expertise, all of the connections you have, your relationships, those all contain your value as a business owner and entrepreneur, and as well as the healthcare provider that you are. So we all know healthcare is shifting. We've seen it over the past few years. We've seen the changes. We've seen how much healthcare has shifted and things have grown, and how even just telehealth and virtual care just exploded. So we see that. That's not even anything to doubt or argue. Healthcare is shifting rapidly, and it's going to continue to shift. Patients want convenience. They want to feel valued. They want to be heard. They want faster access. They want instant access. They want personalization in their care. So with that being said, that means the cash pay market is growing. No longer do you have to worry about, oh, am I going to be able to get credentialed with insurance companies to grow my business? That is not the case. Cash pay services are growing. People are moving away from traditional appointment. They're also starting businesses. And so with that being said, not everyone has the access to traditional health insurance like many of us did 10, 15 years ago. And wellness and prevention is increasing rapidly. Some of you have probably been on my peptide webinars that I've been doing recently. That is just increasing exponentially. Telehealth is becoming normalized. It is becoming normal to, have chronic diseases and see a provider virtually. No longer do patients have to go in to be seen. No longer do they want to go into the office to be seen. And studies are showing, research is supporting that NP and nurse-led care is on the demand, and that there are improvement in patient outcomes with NP and nurse-led care. So what does this mean for you? It means that you don't necessarily have to start off with this huge clinic. You don't have to figure everything out. You don't even have to know everything to get started. What you do need is the right roadmap. What you do need is the steps that you need to take to ensure that you're building your practice on the right foundation and that you have the right structure. So what I'm going to share is my 3-pillar healthcare practice launch framework. This is the exact same steps that I've taken, and this is the steps that I've implemented for many others that I've helped start up their businesses. Pillar 1 is the model. This is this determines your schedule, your flexibility, and how you're going to generate revenue. Your model does not have to be something complex. It doesn't need to be something overwhelming. It doesn't need to be a model in which you have to invest or put up a whole bunch of money, and then next thing you know, you're starting your business upside down. This is very simple. You start simple, you choose a model that aligns with your lifestyle. And you want a model that's going to support your long-term vision. And that's going to look different for everyone. That is not going to be the same. You may have a model that is just one type of model. You may have a model that's a hybrid. You may start with one model and transition to a different one. It's going to look different for everyone. So let's look at those practice model options. Now, these are the 5 models that currently are tried and tested and work right now, and they will continue to work 5, 10, 15 years from now. Virtual care, as I mentioned, telehealth, it's the model that has grown probably the most in terms of you don't have to do synchronous visits, meaning you don't have to be face to face like on a video anymore. Now they have where you can do asynchronous telehealth care, which means the patient is messaging the provider. And of course, this works for certain services. Obviously, this is not the type of care that would be suitable for something like urgent care, but there are many different services that you can offer in an asynchronous model via telehealth. And then also with telehealth, it's a great way to start because it's low cost, low overhead cost. And you can definitely expand and grow telehealth across multiple states. It doesn't have to be just the state that you are licensed in. You can expand virtual services across many states. And that will allow you to grow your practice as well. And so that is a model that definitely, if you are someone that you just maybe like to travel, or you just want to be able to be at home and you want to create a schedule that is most flexible, telehealth would be an option in terms of starting up a practice where you are able to control the setting and the hours that you work. And very much telehealth practices are growing exponentially. And then you have the brick and mortar model. So this is where obviously this is a physical location. This is more traditional. Now, having a physical location definitely has its benefits in terms of growing and adding services. And I know a lot of times when people think about having a physical location, they're thinking about the cost and the expenses, and that is definitely true, but it does not have to be costly. For one, when you start a practice, and if you want or need a physical location, you can definitely start off with subleasing or doing like office suite as needed rentals. So subleasing is where you would maybe rent an exam room from another office or another provider, or a chiropractor, a physical therapy office. They may have, extra exam rooms that are not being used. You can definitely consider that as an option where you can rent on a monthly basis or on an as needed basis. The same concept of like salon suites, that can also be done for medical services where you can rent as needed, maybe one day a week or 2 days a week, or more often, more on a part-time, regular basis. And you can build up to where you are able to grow your patient base. You are able to generate revenue where then you can move on and, look into a larger office space and not have to jump into a physical location that's going to cost you thousands of dollars a month. But starting simple, starting with 1 day a week, twice a week, a couple days a month, you can very much grow and build your practice in that manner. However, in my opinion, and from what I've seen, having a physical location definitely has its benefits in growing your practice. And yes, the overhead costs can be more, but that's why you want to do it in a stepwise approach. I have seen providers start practices and, they go out and get large office space, and then they're having a hard time with the costs and expenses because they're handling on their own. Now, if you do want to go out and get an office space that is, has a couple of exam rooms. You should also look into subleasing that space to other providers. There's other providers who are just like you starting out. Depending on where you live, you can probably rent it out anywhere from $500 to $1,000 a month. And while you're growing your practice, you're also creating another stream of income where someone else is not paying you to use the space. So consider that in terms of the brick and mortar model. Then you have hybrid. Hybrid is where you can combine two or more models. So, for example, you can have a physical location, but you can also do telehealth, or you can have a physical location, but you can also do home visits. There's nothing that says that you can't do more or have more than one model within your practice. And that then brings us to the mobile and on-site model. Mobile is where you are going to the homes or the locations of your patients. And then also being on site, you're also mobile, but you're also on site for maybe a specific time period. For example, maybe you have a contract with a corporation and you are helping them with a corporate wellness program, and you go to that site once a month for an entire day, and you provide whatever services, so that you can definitely incorporate that type of model with mobile services. Mobile doesn't just have to be that you're seeing one patient at a time in going to different homes, but you can go to a location and where it kind of is like a hub for the people that are in that location to see you. Now, facility based, it's similar to on-site, but in this case, facility-based model is where there are actually patients that live within that facility and require either assistance or round-the-clock care, such as a rehab facility, a nursing home, an assisted living facility, a group home, a recovery center. So these are where your patients are there. They live there, whether they live there long term or for a short period of time. You can grow your practice. You can provide many services in a facility. You can do primary care, specialty care, psych mental health, IV infusions, skin care, whatever the case is. There's really no limit in terms of what services you can provide in a facility such as the ones that I mentioned. So those are your practice model options. And you have to choose the model that fits your life. You have to choose what's best for you. If you have young children and you're wanting to grow your practice, you want to probably choose the model that's most accessible and flexible for you. Maybe going to facilities maybe doesn't fit your lifestyle. Maybe, being in a physical location doesn't work for your schedule to have patients scheduled, throughout the day, and you're in the office all day. And that may work for someone else. I love to go in the office. I personally am not a fan of telehealth. I do offer it. But I love to go in the office. I love for patients to come in. I love to do my evaluations hands-on, but I do understand in some cases that may not work for all of my patients, depending on what's going on in their life. So I definitely do provide, the opportunity for virtual services as well. So you have to look at your time availability. Also look at your budget. You do not need $10, $15, $20,000 to start a practice. You can definitely start on a smaller scale with a smaller budget, but you do have to know what your budget is. Know your patient population. What is the demographic that you want to serve in your practice? What types of services are you planning to offer? You have to know your patient population to determine what model best fits your life. And you have to look at the vision. What is your vision in terms of growing your practice? And what do you foresee for yourself? So when you're able to determine that, you're able to determine what model best fits your life. So, pillar two is your method. This is your niche. This is your specialized area. This is, where you thrive the most. This is what you're most passionate about. This is where you've seen a gap. This is where you've seen growth. This is whatever it is that you desire to serve patients the most. So you want to choose your niche and services that match demand and your expertise. So you have high demand specialties, cash pay service lines, but you want to also remember to keep it simple. You want to be sure that you're offering services that are profitable. This is also, important, especially in aesthetics, where sometimes there's services that are kind of not as popular or kind of phasing out. And so you kind of have to, go where the demand is, and you got to introduce new services, or definitely find out what's, the thing or the service that your clientele is looking for. So this is your method. This is pillar two. And so for 2026, there's some high demand areas in the healthcare market that are not just high demand in 2026, but they'll be high demand and beyond. Primary care and primary specialty, always in demand. So whether you do general primary care, or if you want to be more focused in your specialty, or diabetes, women's health, cardiovascular, endocrinology, whatever the case is, these two, primary care and primary specialties, are always in demand. Weight loss and metabolic health, I mentioned it before, peptides, growing. Everybody wants to be on a peptide of some sort. And so that is continuing to grow in terms of either offering those as a standalone service, or incorporating those treatments into an existing practice. IV hydration and wellness, again, continuing to grow because people don't just want sick care anymore. They want preventative care. They want longevity. They want the things that keep them young and rejuvenated. So this market is definitely continuing to grow. Aesthetics and med spa services, always growing. I've never seen where a med spa wasn't being built, a new med spa wasn't going up in a city. So definitely always growing. Mental health and psych, people are definitely seeking out mental health services more. I am happy that the stigma is still there, but it definitely has decreased in the past few years, and people are seeking out services for mental health. Men's and women's health focused services are always in demand. Functional and integrative wellness, definitely always been in demand and growing. And chronic care programs where now insurance companies are wanting providers to make sure that chronic care measures are being met for patients, especially in the geriatric population, especially with Medicare and Medicare Advantage programs. So these are areas which I'm sure all of you can say, yep, that's exactly the area that I want to build my practice. And so you can see that these areas are growing. The revenue potential is very high, and the patient demand is there. So you only need to start with one service. You do not need to start with multiple offerings. And again, this definitely depends on the type of practice. So if you are going into a specific area, you want to ensure that you start with a simple plan of the services that you're going to offer. You don't feel like you have to offer everything. If you want to do primary care and aesthetics and IV infusions, You don't have to start your practice on day one with all of those services. Start with the one that's most accessible. Start with the one that's not going to cost you a lot of money to offer. And then you want to build your patient base with that service. All right. Same thing with your offers. Keep it simple so that patients aren't confused about, well, what am I booking my appointment for? I don't know what I need. They don't have to see everything you offer on your website. Even if you have more than one offer, let it be so that you build on whatever service they need. You can do add-ons. You can create a package for them. Encourage them to join a membership. Whatever it is, it doesn't mean that you don't have those offers, but it means that the patient doesn't need to necessarily see all these offers and then they don't even know what they want. And then they're confused. And then, they're like, well, I don't know what I need. I'm not going to book an appointment until I figure it out. They're never going to figure it out. So keep it very simple in terms of the servicing and your offers, especially when it comes to your marketing. I have seen where sometimes there's too much going on in a practice, and you're trying to figure out, okay, what do they specialize in though? I see you doing all of this, but what's your specialty? So when patients go on your social media, your website, whatever the case is, they need to know, what is your specialty? What is that one area that they know that you are the expertise in? And so therefore that also goes with one patient type, one channel. And as I mentioned, this is starting. This doesn't mean that you stay with just one niche, one offer, one patient type, one channel. But as you grow your practice, as you grow your patient base, you will definitely add on as time goes on. All right, pillar 3 is your momentum. This is your systems, your structure, your foundation, everything in your operations. And also your launch plan. So this is where I see a lot of people do mess up, right? They're like, well, I'm just going to launch and then I'll figure it out my systems later. And that is probably one of the biggest mistakes you can make. You don't want to just launch for the sake of launching, just to think, well, if I launch right now, I'm going to start seeing patients and then I'll figure out what's going to work. That's a recipe for disaster. You want to make sure that you have a sound business foundation. You want to make sure all of your systems, everything in terms of operationally, and operationally can include not just structure, but it can include the legalities, compliance, technical things, applications, EMR, all of that. That's all within your operation protocols, consents, and all of those things. So those are not things that you want to just wing it on after you launch. These are things that you want in place before you launch. And then you have a launch plan. You have to have a plan to launch. And just saying, well, I'm just going to go out and do it. That's not what you want to do. You want to ensure that you have all of your ducks in a row. You want to make sure all of your boxes are checked, and making sure you have everything up and running. The best way I can explain it is that when patients see you, or when they're coming into your office, or when you're going to do a visit, they should see that everything looks and perfect, and that your systems are in place. And if there's chaos going on, let the chaos stay in the background, but they don't need to see that in the forefront. So for business basics, you want to ensure that you have a clean, compliant foundation for your practice. Okay. So this may include a business registration, it will include a business registration. Some of you may have to register your business with not just your state, your Secretary of State, but also depending on where you live, you may need to register your business with your county. You may need to register your business with your city. You may need to register or notify your board, whether that's the Board of Nursing. If you're going to be working with a collaborative physician, the Board of Medicine may need to be notified or receive a copy of the agreement. So you want to install and make sure that everything is in place with the business registration. Your EIN, you have to operate a business with a tax ID, and that comes from the IRS. Your MPI numbers. So if you are a provider, in terms of if you are a nurse practitioner, PA, or physician, you should have an NPI number already. But then there's also another NPI. You will have an NPI for the business and the types of services you offer. So you have to have that. Business bank account is important to ensure that all of your funds, whether spending, expenses, revenue coming in, are all being tracked in a business bank account. You want to ensure you have your insurance policies in place. That is malpractice and professional liability. So you do not want to risk doing any business without ensuring that you have the proper insurance policies. And just because you work for an employer, it does not mean that your employer's policy that covers you is also going to cover you in your business. And you don't want to find out what would happen if you don't have your own insurance policy. Policies and protocols, templates, those are things that you want to ensure that you also have in place in terms of just the basics of the business foundation. Operational setup, everything that I mentioned in terms of your EMR and your systems, your workflows, forms, consents, scheduling systems, messaging systems. You want to make sure everything is compliant, one, HIPAA compliant, and then you want to make sure everything flows together, and making sure that it works for you. In terms of the services that you're offering and how you want your workflows to be managed. Okay. So, there's all types of systems. And, if you've ever seen an ad about, this EMR can do all of this and that EMR can do all of that. But the thing is that, does it work for you? Does it work for your practice, your business? So be sure that you do your due diligence in finding the systems that work for you. Don't be sold on systems that, it looks great, it's high tech, it's pretty and shiny, but it's costing you $500 to $1,000 a month, and you're paying for it on day one, and you're locked into a contract. That's not going to work for you as if you're a new business owner with starting on a lower budget. And even if you're not starting on a lower budget, it doesn't mean you have to throw hundreds of dollars into a system that has all these features that you're not even going to use. Reimbursement options. This is also a part of your systems, how you're going to actually get paid. So, you want to make sure that you have the payer models in place for your practice. So whether that's cash pay, or you're doing insurance credentialing, or contracts, maybe employer or government contracts, or hybrid, meaning any of these two or more. You can definitely have many ways in which you're receiving payments and reimbursements, but you want to make sure those are being processed, and that you're able to track those payments. And so therefore, you want to ensure that incoming payments from insurance companies are going through into your system, where you can make sure, okay, you got paid from this patient. You want to ensure, if you have a cash pay model, that you have recurring payments set up for memberships or packages. If you have a contract, ensure that vendor is paying you appropriately for the services that you offer. So you want to make sure everything's going through a system. It's highly important that you have a bookkeeping system. I personally love QuickBooks online, or you have a bookkeeper, an accountant, that you can be sure that the money coming in makes sense and that the money going out is being tracked properly. Your branding and your presence. This is probably by far one of the areas in terms of the pillar 3 that I see also a lot of people kind of slack on. And I understand, for one, a website, it can be an expense that you might think, well, I can hold off on that. And I have met with many providers, new practice owners. They reach out to me. They say, Dr. Chung, I started my practice. It's been 3 months, it's been 6 months, but I'm not seeing any patients. And I'm like, okay, send me the link to your website, your social media, your Google business profile. Let me do a review and audit for you, and I'll get back to you. And they're like, well, Dr. Chung, I don't have my website up and running yet. Or I have a Google profile, but there's nothing on it. I haven't updated it. I didn't request any reviews. I made social media, but I don't really do social media. I mean, I've heard it all. And I'm here to tell you, in 2026, if you don't plan to have a website, a Google business profile, social media pages, it's going to be hard for you to really grow your business. And this is not the area that you want to slack on. In terms of all of what is on this screen, it's very important. People are going to check your website, check social media, check Google reviews before they even make the determination that they want to schedule an appointment with you. I can tell you guys, almost on a weekly basis, patients come into my office and they're like, oh, you have really good reviews. And to that, I light up inside. I love it, because that's what I want to hear. That's what I want people to see. And so I want that social presence. I want that social proof of the services that we offer and the care that we are giving people. And so that's going to help to attract more people. I always ask every new patient, how did you find us? Oh, I searched on Google. Oh, they're talking about you in the wives Facebook group I'm in. Just all random places that apparently that people are sharing our post and whatnot. But that would not be the case if we did not show up on Google, on social media. And it doesn't have to cost you a lot of money. Probably your biggest expense in this area will be your website, but that's with good reason. Your website is your 24 hours, 7-day-a-week employee. Your website is working for you when you are not working. And if people can't find your website, then that means they think that you either don't have any credibility, they think that you are not who you say you are, they don't think you're legitimate. It's just not where you want to cut your budget. I do not want to see anyone, with abcclinic@gmail.com. Spend the $12, I think it is, a month or a year, buy your domain, create a professional email account. It's very important that you have these things because it adds to your credibility as a business owner and a care provider. Hire someone overseas to help you with social media. You do not have to be a social media expert. You don't have to spend hours trying to post on social media. Don't do that. You have other things to do. So you can definitely hire virtual assistants to assist you with these things, because all of these things definitely take precedence in the patient experience. So with that said, we have the launch light method. So I've been talking about it throughout this training, that you start simple, you want to build momentum, and you want to expand with clarity. So you want to start simple in a way that works for you. You do not want to, again, whatever works for you. Everyone's different. So whatever your budget is, that's what you want to work with in terms of starting. So you want to keep your overhead cost as low as possible. You want to ensure that you're executing quickly. I have also seen where providers just kind of just let the process go and they're right there to their launch and then they get off track and life happens. I get it, but you don't want to get off track to where you're delayed 6 months and you're delayed another year, and then next thing you know 2 years have passed and what you built you haven't executed. And you want to ensure that you have a scalable foundation, so starting with the one service, one offer, one niche, one patient population, and scaling from there. Maybe in 3 months you add a second service. And every 3 months you may add another service. You may do another launch for another service that you want to offer, but you want to ensure that you start in a way that is most manageable for you, and that's with the launch light method. So the question I always get in this process is, how much does it cost to start a practice? And that really has a lot of factors that affect costs. So that is determined by your practice model, the patient population you're serving, your location, your market. There's a lot of factors in terms of how much does it cost to start a practice. So you want to start, if you want to start at the absolute lowest, leanest way, that's with telehealth. If you want to start with the lowest cost or the low cost, but with minimal equipment and supplies, then consider doing mobile services or on-site services. If you want to start with a scalable way to offer services in person, brick and mortar, but starting with, as I mentioned, subleasing an exam room or doing some type of medical suite rental model, so that way you can scale to a larger office space. Facility based is also very low cost because it's based more on contracts and making connections with facilities. That does help you to create revenue quickly. And as I mentioned with hybrid, you can integrate any two or more of these models into one. So in terms of cost, it's going to definitely cost you, but it also doesn't have to cost you a lot. And if you are on a lower budget to start your practice, choose one of the lower options. I personally started out mobile, and I think within less than 6 months, I was able to rent a small office space. And from there, within less than a year, I then moved on to a larger office space. And now I'm looking at other locations. So I can tell you for sure that you can scale no matter how you start, but you want to ensure that you're starting with smart investments. So in terms of recurring revenue, so when you are pricing or developing your services, you want to make sure that you create some type of way to have recurring revenue. Recurring revenue is predictable income. So you want to build memberships, you want to build programs that creates long-term loyal patients. So if you just don't want to deal with, guessing who's going to come in or who's going to be seen or how many patients are you going to see next month, when you build a membership or some type of program, that's where your patients will pay on a recurring basis. And that's predictable income for you. And you can grow and scale. For example, if you have some type of membership, you can have a primary care membership, an IV infusion membership, an aesthetics membership. Let's see, for example, I have seen psych mental health memberships as well. You can really turn anything into a membership. And so that way, those are patients who are your recurring patients. Those are loyal patients. Those are patients that are sticking with you. And also monthly programs, chronic care management. So you can implement things that, for example, remote patient monitoring. That's a way that if you have a patient, let's say, for example, high blood pressure, you need to monitor remotely. You can implement a remote patient monitoring program. Those are reimbursed by insurance companies, but you can also charge cash for remote patient monitoring of any type. And so you want to maybe implement that if you are managing patients for chronic care, employer contracts, government contracts. For example, one I always like to use, DOT physicals. You may get a contract with a company that has CDL drivers, and they're going to send all of their contracts or sorry, drivers to you to do DOT physicals, subscription add-ons. So you may have a subscription-based service where then it can be done in tiers. If they want this level of service, that's extra. And if they want to go up a tier, that's going to cost whatever amount that's going to cost. So these are ways in which you can create recurring and predictable revenue for your practice. So let's go talk about why most providers never launch. And it's not because they don't have the ability. It's not because they're not smart, or it's not because they don't even have the money. That's not even the reason. It's really because they don't have the structure and they don't have the guidance and support to do so. They started the process with great intentions, but they're just winging it. They're just like going with the flow, and they're just going to throw something out there and see what sticks. And that's not what you want to do. There's too many unknowns, and they're receiving a lot of information from different places that are conflicting. They are dealing with fear, and that's valid, especially when you're starting a practice and they're trying to do everything by themselves. And so that's where I have seen most healthcare professionals get stuck in this process, is because they are not following a clear roadmap. They are dealing with a lot of doubt and fear, and usually that comes from lack of understanding and knowledge. And so therefore, that's why you want to educate yourself. You want to make sure you do research and understand your market, your services, your scope, your state laws, whatever the case may be. And all of those unknowns are then answered, and then you have less fear and doubt. And you want to ensure that you are getting help from reputable sources. So you don't want to try to do it all alone. If you don't understand something legally, you should be discussing it with an attorney. If you don't understand the taxes, and how to handle business taxes, you shouldn't be trying to do that on your own. You should be talking with an accountant. Same thing, with business. If you are just not sure how to implement the steps and what to do next, you should be following a program that's going to help you do that. So the solution to that is to have a proven framework that helps you, a proven framework that removes the fear and the doubt and the misunderstandings and the conflicting information, a program that's going to give you a clear roadmap, that's going to give you guidance, that's going to help you with your systems and operations, and that's going to help you with a profitable and predictable launch plan. So with that said, I introduced the Healthcare Practice Business Startup course. So this is a comprehensive 12-module system that guides you from going from business idea to business launch. It is a program that I created 6 years ago. And in the height of COVID, I had a handful of providers that that reached out to me, and I said, okay, I'm going to create something to help you all. And they all ran with it. And so I have then now been able to help hundreds of people through this program. And it is the steps that I've taken, the steps that I've learned, and the steps that I've also used to help many healthcare providers like you all. So it is a 12-module program that covers every stage of launching any type of practice, whether primary care, primary specialty, psych, mental health, telehealth, med spa, whatever it is. This is the steps that you would take to launch any practice. So this is just an overview of the modules and what it covers, everything that's included. And then you do receive additional bonuses and value in the course. I talked a lot about having a sound foundational a structure and operational system. So within the course, there are policy, procedure, and consent templates, IV infusion templates, aesthetics, medical weight loss, collaborative physician and medical director contract templates, lab and vendor lists. And so you have lifetime access to all of the content in the program, as well as when we have updates, you also receive that content as well with no additional costs. So for those of you who are like, well, I already started, do I need this? And the question is, yes, it's still for you. I have had plenty of providers that have started the process on their own, and they have come to me because they were stuck. They didn't really know what to do next. They knew the basics, the foundation. They knew to register their business, get a tax ID, open a business bank account, insurance policies. They knew what EMR, but they didn't know what to do after that. They didn't know what the plan was to really get patients in the door and actually, run a real practice. And that's okay. None of us were taught any of this in school, and that's okay. So naturally, they found themselves stuck. And that happens a lot. So a strong foundation helps you to determine whether your practice can grow. So if you do steps out of order, that does create problems. I've seen it. You have a partial setup, and then that's also creating gaps and leaving you open for legality issues. You are probably, getting some free stuff here and there. This person's offering to download, that person's offering a free package, whatever the case may be. And so then you're gathering all this information from everywhere, and none of it is making sense. You're having delays because you're not completing documents or registrations or applications properly, exposing your license. So what we have to remember, even though we're becoming business owners, we still have a license to protect, and you want to ensure that you have the proper policies and consents in place. And then you have weak foundations, which if you start your practice with a weak foundation, just like my clients that have helped who told me they didn't have a website and they're wondering why they're not getting any patients. That's an example of a weak foundation, and you really can't see your revenue and growth if you have a weak foundation. So for those of you who are joining today, we have a special rate for the healthcare practice business startup program. The original course rate was $2,997, and we have dropped that down to $1,997. That does include all 12 modules, all the templates, all the bonuses, resources, and lifetime access to the program. And for those of you who do use Afterpay and Klarna, we have the availability where you can pay full using any of those options, and whatever payment plan options Afterpay or Klarna approve for you. We don't know if you use it. We won't know. You will just have the ability to use those options to pay. For those of you who just want more of a straightforward, flexible option, we do have where you can do 6 monthly payments of $350. So if you want to scan that QR code, or I will have the link in the chat, you can go ahead and take a look. And everything that I mentioned is what is already in the course. So we are having a limited healthcare provider access rate, subject to change at any time, for $1,997. So you have to ask yourself why this makes sense for you. When you save time, money, and you avoid all those other costly mistakes, you're able to focus on growing your practice. I can tell you guys that I have made costly mistakes. I have made mistakes early on in my entrepreneurship journey. Not that they were mistakes, but I did things earlier on that I should have waited, or that necessarily didn't work for my model and my focus for growing my practice. So you want to avoid those expensive errors, unnecessary expenses. You want to start with that clear roadmap avoid the confusion, and this will allow you to launch sooner. I have had students in our program that have literally launched med spas in less than 3 months going through this program. And that's probably by far one of the most intricate, complex practices that to start, just because of all the intricate details with aesthetics. But nonetheless, you can launch even sooner than that. So when you're able to launch sooner, you're able to earn sooner. And you don't want to leave money out there on the table. So the sooner your patients can find you, the sooner that you can generate revenue. So you are ready for this because you know that this is what you need. You joined this masterclass because you know that you've been thinking about it, praying about it, wishing about it, and now it's just simply the time to take action. So you want to start building the practice that you've been envisioning and dreaming about and make it a reality. So enrollment is open. You can decide which option you want to choose in terms of payment, and regardless of which option you choose, you get to start the course immediately. So there's no limit in terms of whether you use the payment plan or not, in how you get to access the course immediately. All right. So you can enroll today. You can start right away, follow the roadmap, and you'll be able to launch sooner and earn sooner. So if you're thinking, I'll do this later, or I'll wait until something, there's something that you've made up that you will wait until that day. Waiting is just going to cost you more money. It's going to delay you. It's going to delay you earning money. It's going to cost you to lose opportunities. You're going to end up repeating cycles, and you don't want to find yourself in that place where, again, 6 months, 12 months, 24 months, 3 years pass, and you're back on my masterclass again. And I'm talking about the same thing again. So I want you all to take advantage of this, that this is your opportunity, where you can go into this program and it'll give you the steps that you need to launch your practice. All right. So I'm going to open up for questions. Again, we have the link in the chat, and that is available. And also we'll put the QR code back on the screen, and I'll look through the chat now for any questions. Okay. All right. So we actually have someone said who they are enrolling. I'm excited for you. Does the course include mentorship and access to you and your team? Yes. So within the course, we do monthly mentorship meetings. And with those meetings, that is the best time to come with your questions. We also have guest speakers, such as, for example, we have an accountant that will be speaking to all of the students next week, which is great because, you know, tax season is here. And so we have different guest speakers, as well as students do have the ability to meet with me one-on-one. If you have questions, if there's something that you're just not understanding and you just want to meet and discuss something that maybe you're stuck on, I am available to you as well. Do you provide state-specific details? So we do provide state-specific details in terms of the business foundations. We do assist you with that. We have done the research for each state in the course in terms of the business registration, what your state requires. We also assist you in terms of like collaborative physician, understanding, you know, your collaborative physician requirements. We do assist you with that. Oh, I didn't also mention, if you do need a collaborative physician or medical director, all students do receive a discount on our collaborative physician network service. So that is available to you as well for all students who enroll. Do we offer recommendations for collaborating physicians? We can definitely help you with finding one. So we can we can help you with that. Once you're ready to find a collaborative physician, we'll connect you with the collaborative physician network team. And like I said, you do receive a discount on that service as a student. And so we can assist you with that as well. All right. Let me see more questions. Let me go to the Q&A as well. There's a question there. I am in California. I've been approved for full independent authority. Does your program have information that applies to California? So yes, we've had many students go through our program that are from California. California is what I call one of my special states. And anything that's specific to your location will assist you with it. So you don't have to feel like, it's you're going to go through this and you're not going to have what you need. If there's a question or if there's something that you need understanding with, we will assist you with that. Okay, great question. We got more questions coming into the chat. Okay, I think Okay, someone said this was one of the best webinars with actual real steps to starting a business without a lot of nonsense. Thank you so much. I appreciate that. That definitely is a screenshot worthy review. Thank you. I am glad that you enjoyed and you found this very helpful. All right. Can people outside the US enroll? Absolutely. I actually have somebody in Ghana that reached out to me for help with doing IV or adding IV infusions. So just know that that would definitely involve more assistance in terms of research. But the understanding of like systems and again, workflows, all of that can definitely, as far as you utilizing the resources in the course, yes, marketing, branding, all of that, no matter where you are in the world. But if you're outside the US, if you're in another country, I will definitely be happy to assist you in this process. All right. Okay, so let me see. Answered that question. How long is this offer going to be available? Great question. So I definitely review pricing regularly, and we have been growing in terms of students and enrollment. And so I don't have like a day or season that pricing will change, but it is subject to change at any time. And so I do encourage you to take advantage of this pricing. This is the lowest pricing I've ever done for this particular course. And as I continue to add and update content and information, it will become more valuable. But whatever price you enroll in, that doesn't change for you. You don't pay for anything extra. Great question. All right. All right. So I think that's all the questions. So again, that QR code's on the screen. The link is in the chat. So definitely, if you have questions, feel free to reply to any of the emails you received for the masterclass. Ask any questions you may have. The options are available to pay in full with Afterpay or Klarna, or you can do the 6 monthly payments of $350. Okay. All right. So I am going to wrap up. So I am so grateful all of you joined today's masterclass. Excited for all you in terms of where you're going in your careers and in business, and to see all of you who continually join our master classes that want to learn and grow and further your career and becoming entrepreneurs in healthcare. It's definitely, a season where there is continued growth for healthcare entrepreneurs. So I'm definitely wishing you all the best. Thank you again for joining, and I will see you soon.